With the number of elderly expected to double by 2050, nursing home care is becoming more and more critical. Chances are you or a loved one will eventually live in one.
Now, these are just a few of the parents, grandparents, and great-grandparents who have relied on Michigan nursing homes to care for them. They're also the faces of just a few of those who died across the state because of mistakes.
In a 4-month investigation, Target 8 investigator Ken Kolker discovered that it happens often. Ken's live in studio tonight.
Brian and Marley, the number of deaths we found surprised even the state. 112 over 3 years caused by medical errors, neglect, or just plain poor care. Most of their stories have never been told. They include the death of great-grandmother Catherine Winters.
My mother was turning blue. Her lips were turning blue, her eyes were bulging. She was reaching out for help. She was putting her hands up to her throat. And all what she wanted to do was have somebody help her. And nobody would.
But they should have, according to reports obtained by Target 8, and the nursing home's mistakes killed her. Her 90-year-old mom, Catherine Winters, was on a soft food-only diet after suffering a stroke, which meant that the nursing home was supposed to grind up her meat so she wouldn't choke.
Ground up meat like in a hamburger consistency.
Right. But in August 2012, state reports show Hoyt Nursing and Rehab Center in Saginaw served her beef tips, and she choked. Reports show a dining room worker jumped into action with help from a nurse's aide, dislodging some of the meat with the Heimlich maneuver. But what happened next stunned everybody in the room. That's when the director of nursing ran in.
The director of nursing told me to stop everything.
Catherine Winters was a hospice patient, which meant do not resuscitate. Her rescuers backed away. A witness said Winters was holding her chest and had a scared look on her face as 2 nurses led her away.
They just did nothing. They didn't call, no for help.
They just sent her to a room, right?
They took her to her room.
To die.
To die.
Her mom was a widowed farmer's wife whose grandchildren and great-grandchildren called her Mimi.
Oh my God, they loved her so much.
The nursing home, she said, told her family that she had died quietly of a heart attack.
My mother died a beautiful death. The angels came to get her. It was very peaceful. That wasn't a beautiful death. Gasping for breath and, turning blue, trying to get a breath. She knew my mother was terrified. She had to be.
Even the woman in charge of investigating nursing homes for the state was visibly shaken by the details. And they led her to the room with a scared look on her face. And she died.
Yeah, there's not a hammer big enough for that. I mean, I don't know how you leave somebody in that situation. I don't know.
It was another case, the death of Barnell Gunter last year at Spectrum Health's nursing home in Grand Rapids, that prompted Target 8 to investigate just how often these deadly mistakes happen. Gunter died after a nurse forgot to check on her clogged tracheotomy tube for 2 hours. After sorting through thousands of pages of inspection reports, we found it happens a lot. 112 deaths at 81 nursing homes across Michigan since early 2011. That's nearly 1 of every 5 nursing homes. That includes 30 deaths in West Michigan. The state agency that investigates nursing homes doesn't keep track of those numbers. Does that number surprise you?
Yes.
Florida-based Families for Better Care, which grades state nursing home care based in part on inspection reports, ranks Michigan as 4th worst in the country. It blames in part what it calls mediocre staffing levels.
We would not stand for these types of problems in daycare facilities happening to our kids.
State reports list victims by numbers, no names. Resident number 101, resident number 501. But death certificates, lawsuits, obituaries, and autopsy reports help Target 8 identify some of those victims. There's 91-year-old Eileen Rocky, a retired secretary who died of an overdose after nurses at Metalodge of Howell mistakenly gave her morphine meant for another patient for 4 straight days. We found 30 deaths tied to medical mistakes. A second morphine overdose, the nurse who forgot to turn on a patient's oxygen, the patient mistakenly given blood thinner meant for another, patients dying from untreated bed sores. Back in Saginaw, Deborah Goss, whose mother was allowed to choke to death on meat she should not have been served, is suing the nursing home. She says the $65,000 state fine isn't nearly enough.
Oh, I get angry about it. I get very angry about it because, you know, they took something from us that they had no right.
Now, despite our findings, the association that represents most nursing homes in Michigan says a growing number are getting higher grades from the feds for the quality of their care, though he acknowledged that more needs to be done. So what happens to homes that make those deadly mistakes? You'll see that part of our investigation tomorrow on 24-hour News 8 at 6.
Everybody's special friend, Alfred Vincent.
Alfie is surrounded by strangers under an oak tree at the very back of a cemetery near Hastings. No family, just as in life. His guardian says he is there before his time, only because of the nursing home that neglected him to death.
People like Alfie don't come around every day, and it's really easy to push him aside because he had no family and nobody to stand up for him.
Alfred Vincent was a mentally impaired 77-year-old man who had broken his hip, which is why he was at Magnum Care of Hastings. He was supposed to stay for a month. In January 2013, Magnum Care called for an ambulance after finding him slumped in his wheelchair. But records show the home sent another patient in that ambulance instead.
So they took her in his ambulance.
More than 7 hours later, his medical guardian found him unresponsive in his nursing home bed and demanded an ambulance.
The emergency room doctor revealed his bag of urine looked like tomato soup. He was septic and it was through his entire system.
There was no dignity for Alfie. He died the next day of cardiac arrest due to urinary tract infection and sepsis. A state investigation prompted by the medical guardian's complaint found Magnum Care at fault.
They told me that people lost their jobs. They told me that they were fined as high as they could possibly fine them.
The fine was $5,818 for that.
Well, that's not really worth a life, is it? So I guess Alfie pretty much died in vain, huh? Unfortunately, there are a lot of Alfies out there.
Magnum Care did not respond to a request for interviews. I'm targeted investigator Ken Kolker.
She wanted anything and everything done to keep her alive. She was very adamant about that.
76-year-old Sharon DeWitt, a great-grandmother, was at Magnum Care of Hastings just to rehab a broken hip. But just in case her heart failed, she told the nursing home exactly what she wanted, in writing. Do CPR, call an ambulance.
She did not want to die, and whatever it took to keep her alive, she wanted it done.
In June 2011, a nurse found her with no pulse, not breathing, and that should have triggered a full life-saving response. But none of that happened. DeWitt's daughter-in-law says the nursing home never gave her those details.
So for 3 years now, I have felt real bad guilt that I did something wrong, and that's why she's gone. And it's been really hard to deal with.
The daughter-in-law says a nursing home worker later told her to demand a state investigation. Now she says she is angry with the state, saying it never got back to her after she called to complain. Never told her it'd fine the home $85,000.
They should have notified me. I'm the one that called and asked for the investigation. Why did the state not contact me and tell me that there was action taken, that they found fault, that they were fined? I don't understand.
State officials, though, say they did not contact DeWitt because it was somebody else who filed that complaint. They said they can't say who because of privacy laws. 3 years later, in a separate case, the state fined the same home $5,818 in the death of Alfie Vincent for a 7-hour delay in getting him the help he needed.
That's 2 of them in 3 years that we know of. Somebody shouldn't be having a job.
We stopped at Magnum Care of Hastings to ask for a comment, left a card with the office, but nobody responded to a request for an interview. I'm targeted investigator Ken Kolker.
A Target 8 investigation has uncovered that nursing home mistakes caused or contributed to the deaths of 112 people over the last 3 years in our state. But what happens to homes that make those deadly mistakes?
Well, new tonight, 6 o'clock, Target 8 investigator Ken Kolker found that the penalties don't come close to satisfying families of those who died, and even the state is frustrated. Ken?
Yeah, Brian and Sue, we found a wide range in fines ranging from $140,000 to just a few thousand. 85-year-old Dolly McGrew, a widowed nurse technician living at Heartland Healthcare Center of Kalamazoo, was known as Grammy. She had 11 kids, 29 grandchildren, 51 great-grandchildren, and 1 great-great-grandchild. She was headed to an oral surgeon in Ann Arbor, 100 miles away. A nursing home maintenance man strapped the electric wheelchair to the bus floor, but did not buckle McGrew into the chair. Those straps built into the bus's wall, he said he didn't know how to use them. He had never driven a patient before. Nobody had trained him. Not far from their destination, he slammed into a curb and blew a tire. The impact threw Dolly McGrew to the floor and killed her.
That wasn't the way for her to go.
Okay.
No.
After investigation into the July 2011 death, the state found Heartland's practices put residents in immediate jeopardy. The fine, $12,100. On the other side of the state, Metalodge of Howell killed 91-year-old Eileen Rocky when it gave her morphine meant for another patient for 4 straight days. That mistake cost the home $16,000.
$16,000 fines, $20,000 fines, even $65,000 fines are nickel and diming nursing homes. It's not going to change their behavior.
A Target 8 analysis of state inspection reports and federal records found that in deaths that led to fines, the average was a little more than $21,000. Michigan ranks second in the nation when it comes to how many nursing homes it penalizes, not just in death cases, but its fines are thousands of dollars below the national average. That's according to an analysis by ProPublica.
If you make a mistake, you're supposed to pay for it. And I don't think my auntie should have passed just on and nobody do nothing about it. There should be something done.
Something beyond the state's $12,000 fine. McGrew's children thought so too. They sued the home and got $900,000. Heartland Nursing Home Administrator Betty Morris refused to talk about the death.
Well, I'm a reporter from Wood TV. Right. We're doing a story on nursing homes. Okay. And nursing homes make mistakes that kill people. And
well, that's true.
The home spokeswoman later called it an isolated incident that has been addressed. The association that represents most Michigan nursing homes says it works closely with them to improve safety.
It's human beings caring for other human beings, and errors occur. And you know, what is the once the incident has occurred, as tragic as it is, the important thing then is to find out what happened and to fix it.
It's the states that investigate nursing homes for the feds and recommend these fines, which must be approved by the Federal Centers for Medicare and Medicaid Services.
Sometimes they'll bump it up, sometimes they knock it down.
The state also requires homes to take steps to make sure mistakes don't happen again. But even the state says it wants bigger fines in cases like the morphine overdose or the death of Dolly McGrew.
Shouldn't there be a bigger hammer for that?
I think you have to talk to the federal government. I mean, I can wish everything I want.
But would you as the state like a bigger hammer?
Me as the state, I probably would.
Now, our investigation continues tonight. What will it take to prevent deadly mistakes? More staff, better training, bigger fines? Those answers tonight at 11.
They could have potentially revived her.
But they never gave themselves a chance.
They never gave her a chance, yeah.
The former nurse's aide, who didn't want to be identified, was working at Laurel's of Sandy Creek in Wayland the day Doris Keller Robbins died.
Nobody took responsibility. It was, someone was, I think, on lunch and said it wasn't my responsibility, and the job didn't get done, and the lady died.
A state report says the 80-year-old retired state worker was lethargic, gurgling from fluid in her lungs, and yelled for hours on May 6, 2012. Help me, again and again.
She was at least cognizant enough to be asking for help, and there was no one that provided it.
Her doctor said the home, while asking for chest x-rays and a nebulizer, never said how bad it was. By mid-afternoon, a nurse found her not breathing with no pulse. After a few chest compressions, the nurse left her alone. They did not do CPR, did not call an ambulance, even though those were her written wishes. It was one of 33 deaths that led the state to issue violations to homes for failing to provide timely emergency care.
She wanted to live. Her rights were violated, and neglected. That's all it is. It's just sad. She was just straight out neglected.
Her daughter is left with thoughts of her mother's lungs filling with fluid.
And essentially, she drowned over a period of 5 hours. I really can't think of a more horrible way for anyone to die.
It led to a $101,000 fine against Laurels of Sandy Creek, the second biggest in the state in cases involving death and the biggest in West Michigan.
We trust these places to treat our loved ones with dignity and respect, and to treat them as if they're human garbage is just unacceptable on every level. And that's what happened to my mother. It would have been kinder if they euthanized her.
I'm Target 8 investigator Ken Kolker.
The details have been eye-opening. Nursing home patients dying of mistakes that shouldn't have happened.
Target 8 uncovered mistakes that caused or contributed to 112 deaths over 3 years at Michigan nursing homes. New tonight, Target 8 investigator Ken Kolker is asking, what will it take to stop the mistakes from happening? Ken?
Yeah, Brian and Marley, one of the obvious questions is this. Would it simply be enough to just hire more nurses and nurses' aides to care for the elderly?
Everywhere you go, you're going to have staffing issues everywhere. You know, unless you're paying $18 to $20 an hour, but you're not, so you're always going to be short-staffed, always.
The nurse's aide, who didn't want to be named, says all 4 of the nursing homes where she has worked were understaffed, including Laurels of Sandy Creek in Wayland, where a mistake in May 2012 led to a death and a $101,000 fine. She says she has never made more than $11 an hour, about what a cashier makes, and says at Laurels she cared for up to 14 patients at a time.
This is a tough job. You really got to have your heart in the right place when you're working with elderly.
While federal records show staffing at Laurels is average, patients there still get 13 minutes a day less nursing care than at the average Michigan home.
And what does that mean for people living there?
It's sad. It means it's taking time away from them.
The average nursing home in Michigan provides 1 hour and 41 minutes of nursing care a day for each patient, about 2 minutes more than the national average. But the head of a national nursing home watchdog group says that is not enough. Families for Better Care gives Michigan an F for nursing home care and ranks it 4th worst in the nation, in part because of its high number of serious violations. He blames that mostly on what he calls mediocre staffing levels.
The more staff you have working on the front lines of nursing homes, the safer the residents.
But the head of the state agency that inspects nursing homes says it's more about training and culture.
You can have 6 people standing around a nurse's station, or you can have every person out talking to people. You know, it doesn't make any difference how many people you have on board if you don't have the right culture.
The wrong culture, she says, leads to mistakes. On Mother's Day 2013, a woman stopped breathing during dinner at Meadowlodge Nursing Home in Southfield. The unit's only nurse was eating lunch in her car, and nobody was filling in. 10 minutes later, another nurse ran in, but the suction machine he hoped would save her wasn't working.
And what does that tell you about the culture of the facility? That would be acceptable?
Despite the troubles, she believes nursing home care in Michigan is turning a corner, with complaints dropping in the last year. The state, she says, has streamlined inspections. Still, in the worst cases, she wants harsher fines, but says that is up to the feds, who have the final say on those penalties. The most the feds can charge is $10,000 a day, which hasn't changed for years. The association that represents most of Michigan's nursing homes says it would consider boosting minimum staffing, but opposes bigger fines.
This sector of healthcare has been fined, has been put out of business, has been all manner of sanctions over the years.
The fact that there are 112 deaths over the last 3 years, does that say that more needs to be done? Are you satisfied with that?
Well, I'm not satisfied, and more always needs to be done.
The state says any change would require legislation, both state and national. Are there some places you would not put a relative?
Absolutely.
You probably don't want to name them, though.
Absolutely not.
Ken Kolker, talk about some of the comments. I'm sure this has sparked a huge dialogue with a lot of folks at home, and you've been seeing some of the viewer comments coming in as well. Is there a trend, or is there a pattern
we've
to these
had a lot of comments. We've had a number of comments from people with their own horror stories about deaths that they suspect something went terribly wrong. But we've also had the other side of that, which is from nurses and nurses' aides who say, they love the people they work with. Right. And they love the residents, and they say that homes are giving them good care. So, just because we're doing these stories doesn't mean that you can paint them all with that same brush.
We'll continue, I'm sure, to look into this issue. It's just opened up so many different avenues to look into now as far as oversight, state involvement, penalties.
Definitely makes you want to do your homework before you just put a loved one in a home.
Yes.
Ken Kolker, thank you. You can see all of Ken's stories right now at woodtv.com. We also have a link to where you can compare those nursing homes and file complaints.